This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of Divine Magic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for Divine Magic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel. Now, without much further ado, let me turn over the time to Dr. Payal Bhargava to take over the session.
15th episode of series of Sailing Through Menopause. Till now, I've talked all about menopause, what are the effects of and how we can manage it by lifestyle modifications. Today, I'll be discussing on a very important topic, what is the treatment of menopause? Welcome all. So menopause and its treatment. Now, menopause, as we all know, is a normal natural event defined as a final menstrual period confirmed after 1 year of no menstrual bleeding. So, as I said, that menopause is a normal process of aging. Why we need to treat menopause? Now, menopause is a normal event, but problems accompanying it are many and varied. The woman suffers from vasomotor symptoms, that is hot flushes, coronary heart disease, cancer, osteoporosis, urogenital atrophic symptoms, urinary symptoms, painful intercourse, and dementia. So all these factors lead to a poor lifestyle in a woman's life. Now, age at menopause has remained constant while life expectancy has increased. So as we can see in this chart, the average age of an Indian woman now falls around 70 to 80 years. And the age of menopause is around 45 years. So most of the life of a woman goes in menopause. So we should make sure that a woman has a good quality of life till she lives. So the Indian age at menopause is around 47.5 years. Later age at menopause is associated with greater life expectancy, reduced all-cause mortality, reduced risk of cardiovascular disease, reduced risk of osteoporosis and fracture, and better quality of life. So age at menopause matters. So what is the management plan for a menopausal woman? So the menopause women we divide in two groups. Group 1 is women which don't have any of the above symptoms, and group 2 is the woman with symptoms. So in the group 1, the woman healthy with no symptoms, we give preventive care. For healthy with risk factors for disease and no symptoms, again we give preventive care. Women with latent disease and no symptoms, again preventive care and treat the disease. And women with comorbidities and no symptoms, preventive care and treat the disease. So what do we mean here by preventive care? By preventive care, we mean lifestyle modifications like healthy diet, a balanced diet, regular exercise, a diet which is rich in calcium for prevention of bone loss, and to treat other diseases which occur in menopause like diabetes, hypertension, and metabolic syndrome. Now coming to the group 2, that is women with symptoms, healthy with no problems, symptoms of menopause are present, then we give preventive care and treat with MHT. Now by MHT here we mean menopausal hormonal therapy. Now, as we have discussed earlier, that menopause is due to deficiency of estrogen hormone. So if we replace this hormone, the symptoms of menopause will come down. So healthy with risk factors for disease, symptoms of menopause, then we prescribe preventive health care and risk-benefit analysis before therapeutic intervention. So in some women, menopausal symptoms can be managed effectively with just lifestyle modifications, that is, including exercise, weight control, smoking cessation, and a healthy diet. There are some complementary medicines. Little evidence supports use of complementary medicine products, which include various herbal remedies and soy-based supplements. Now, soy is very rich in estrogen, so that can be used to manage menopausal symptoms if they are very minor. Now, systemic hormone replacement therapy, or what we call HRT, is currently the most effective treatment for vasomotor symptoms and may also improve vaginal dryness, sleep, and quality of life. For those wishing to avoid HRT, there are non-pharmacological and non-hormonal pharmacological treatments for vasomotor symptoms. Most non-hormonal treatment act quickly, so if there's no improvement after 2 to 4 weeks, consider a different approach. Management of menopausal symptoms should be individualized and address patient aims and preferences for treatment. Therapy should target the symptoms that most affect function and quality of life. So all about managing menopause is to improve the quality of life of a woman. So coming to the hormone replacement therapy, there are some patients whom we approve the medication of hormone therapy. Therapy of menopausal symptoms such as hot flushes often is short-term, 2 to 3 years. If treatment can be tapered and stopped within 5 years, no evidence of increased risk of breast cancer is seen in these patients. It prevents osteoporosis also. In women with intact uterus, hormone therapy consists of two hormones, that is estrogen and progesterone. Whereas in women who have undergone hysterectomy, that is, they don't have the uterus, estrogen therapy is given unopposed by progesterone. So what are the benefits of hormonal therapy? Hormonal therapy reduces the vasomotor symptoms and hot flushes. It reduces osteoporosis and the risk of fracture in women. It improves osteoarthritis, that is joint pains. It reduces heart diseases. It reduces the risk of diabetes mellitus. It reduces abdominal obesity. It prevents cognitive impairment. It reduces neurovascular macular lesions. It reduces the risk of few cancers. One of them is colorectal cancer. It reduces the risk of endometrial cancer, and it improves the quality of life. So as we can see, MHT has a number of benefits, but most of the women are unaware of it, or those who are aware are very afraid of taking the hormone therapy, thinking it will harm the body. But it is not so. It has a lot of benefits, and it really helps patients in improving their quality of life. So as I've stated, MHT is currently the most effective treatment for reducing hot flushes and sweats. It improves other symptoms, including sleep problems, mood swings, feeling down, and pain during sex. It can be used to prevent bone loss in postmenopausal women and reduces the risk of fracture. Now, 30% decrease all-cause mortality occurs in women who are taking hormonal therapy, and 48% there is decreased risk of heart disease. MHT started 10 years after menopause reduces the risk of all-cause mortality and heart disease compared with placebo or no treatment at all. Now, there's a terminology called as premature menopause, in which menopause occurs earlier, that is before the age of 40 years. There's primary ovarian failure, surgically induced menopause, radiation-induced menopause, chemotherapy-induced menopause. These may be linked with smoking, lower socioeconomic groups, increased basal metabolic index, and family history. So any woman who attains premature menopause needs to be treated with hormone replacement therapy. till the age of 50 years or the normal age for that country of menopause. Now, primary ovarian failure may occur at any age, and usually no cause is found in these people. It may be linked to chromosomal abnormalities, autoimmune disease, enzyme deficiency. It affects around 1% of women aged less than 40 and 0.1% less than 30 years of age. The women with primary ovarian failure may attain intermittent ovarian function for years, and spontaneous ovulation and pregnancy may be possible in few of them. So the take-home message for today's session is HRT is the most effective treatment for menopausal symptoms. Risk may be balanced against benefits. Treatment must be individualized for each patient. It is the lowest effective dose for the shortest possible time which should be given. Regular review recommended with ongoing discussions of risk and benefit balance. Prescription prior to age 50, and there's no increased risk of other problems. No maximum duration of treatment. Choose between oral and transdermal HRT options and consider the progesterone. So thank you so much for your patient hearing. For appointment, you can call me on this number, emphasizing again on hormone replacement therapy for menopause. Thank you.